My older brother Max has a terminal disease. He always has, and he always will. He has a condition called cystic fibrosis, which among other things is a flooding of the lungs. It's an immune disorder. This Thanksgiving though, I was talking to my mom, and she said when he was diagnosed at 18 months, she wasn't worried about the disease. She knew he was tough. She was worried that my dad would lose his job. Because if my dad lost his job, we would lose our insurance. And those hospital bills, the weeks my brother had to spend in the hospital, would come to us. Hundreds of thousands of dollars. But we were lucky. My dad didn't lose his job. He had that insurance. But millions of Americans aren't. And millions of Americans have these conditions. That is why I'm proposing that the United States federal government adopt a single-payer healthcare system in which the federal government fronts the bill for these hospital visits. This would give the right to life to all at a lower and more effective cost. Currently, the healthcare system in the United States is fundamentally flawed, and it effectively mandates insurance. This is for two main reasons. First, treatments cost far more than they should. According to the World Health Organization, the US government spends more per capita and more as a percent of GDP on healthcare than any other nation, even those that have adopted single-payer healthcare. Healthcare is also treated as a commodity, in which the sick are avoided as they're not profitable, and the healthy are targeted. This creates a paradox where these insurance industries, this $730 billion industry, avoids the sick. It's a paradox. And furthermore, these insurance agencies, they haggle on price. This means that these hundreds of thousands of dollars of bills that my brother incurred were not actually paid by these insurance agencies. The only people that actually pay full price are the uninsured. It doesn't make sense. Furthermore, many Americans cannot even afford to obtain health insurance. 35 million Americans lack any form of health care. 35 million. And a quarter of those who are insured have such high premiums and such high deductibles that they are considered underinsured, meaning they can't actually afford the care they need. And pre-existing conditions, like my brother's, the pre-existing condition he was born with, are frequently not covered. Insurance agencies can say no to no. So what is this causing? This is causing Americans to currently die due to preventable conditions in a greatly faulty healthcare system. First, the uninsured lack the financial ability to afford healthcare until it's too late and most needed. The American Journal of Public Health found that 45,000 deaths occur each year simply due to a lack of healthcare. These are preventable causes, things that can be avoided. Yet still 45,000 Americans die simply because they can't go to the doctor. The Harvard Medical School, too, found that if you are uninsured compared to someone who is insured, you're at a 40% increased risk of death simply because you don't have insurance. And these high costs incentivize reactionary care. This means you don't go into the doctor when you want to check up, when you need to screen for diseases. It means you go when you're in pain, when you really need the care, and frequently when it's too late for that care. Diseases are preventable if early. Diabetes, heart diseases, two of the leading killers in America, are preventable if people go in and screen for them. And other diseases, cancer, my brother's cystic fibrosis, are treatable if they are found early. Furthermore, these high deductibles mean people can't go in for these checkups. They forgo that opportunity, and they can't screen for these diseases. So what do? The U.S. federal government must adopt a single-payer healthcare system so that all Americans have access to healthcare. Congress has already vowed to repeal and replace the Affordable Care Act. I say let's do it. Well, let's replace it with something that works. States like California, Vermont, have already stated their intention to move towards single-payer healthcare. Merritt Hawkins, a physician recruitment agency, found that 56% of doctors currently support single-payer. Although that number may be low, it is greatly increasing. In 2008, that number was at 40%. Single-payer healthcare is on the horizon. We need to enact it now before more Americans die. So the way this would work would be called a value-based care or capitation system, in which the federal government allocates a certain money to regional hospitals or a group of hospitals, in which they give a certain amount of money, and these hospitals are allowed to keep that money. This would allow hospitals to be incentivized to act as preventative care. Instead of treating patients when it's too late, when they're too sick, they would prevent them. It's keeping patients healthy, keeping them alive. Now, this single-payer healthcare would not cover all things. Things like LASIK, liposuction, would incur fees. But when someone needs something to live, when something needs someone to be healthy, that's what it comes in there for. So why do we not have this already? Critics argue 2 main points. Critics say that single-payer healthcare would generate extreme costs and medical inefficiency in the industry. I refute both these points. First, single-payer healthcare gives money to the healthcare industry, not third-party payers or insurance industry, a $730 billion industry. All that money can simply go back into healthcare instead of lining the pockets of an insurance agent. And this capitation of funds, the value-based care, would incentivize this preventative care. It's cheaper and it's far more effective. Physicians for a National Health Program estimated that single-payer healthcare would save the U.S. healthcare industry, the hospitals themselves, $375 billion each year. And that's due to the inefficient administration costs of multiple payers. The back room in a hospital, all the paperwork, would be eliminated, and simply a bill would be sent to the government. Second, on efficiency, single-payer healthcare would be more effective and efficient. The National Center for Chronic Condition Prevention estimates that chronic conditions, cancer, my brother's cystic fibrosis, already makes up 85% of U.S. healthcare spending. 85%. These are the people that the insurance industry tries to avoid. And the federal government is already paying for them. Why don't we just pay for them early, give them preventative care, keep them healthy, rather than playing catch up on these diseases? And if you need more proof, just look to the north. Canada has had a single-payer system for decades, and they've had better health outcomes at a lower cost per capita than the U.S., where medical costs are currently rising. Canada spends about half as much of their GDP on healthcare, and by the 2 main metrics to judge health outcomes, infant mortality rate, life expectancy, Canada far bests the United States in this regard. Healthcare should not be a political issue. It should be about saving lives. Adopting a single-payer healthcare system would increase medical efficiency, decrease costs, and most importantly, save lives. We as Americans are all guaranteed life, liberty, and the pursuit of happiness. But are we really guaranteed life if we can't afford it?